Can a scoliosis back brace correct bad posture? Scoliosis back brace has been used to treat scoliosis for many years, if not many decades. And a back brace is an orthotic device that fits around the torso and is worn to try to alter the progression of scoliosis and the position of the spine potentially. And this really depends on the design of the scoliosis and what it's intended to do. There are many different types of scoliosis braces with many different designs, and the design really determines the treatment goals associated with this type of brace. Traditional scoliosis braces are typically limited in what they can achieve because they're normally designed to treat scoliosis as a two-dimensional condition, meaning primarily a bend. However, when the spine rotation makes scoliosis a true three-dimensional condition, the treatment needs to be addressed in such a specific way that it's trying to improve all three dimensions. Now, modern corrective braces, such as things like ScoliBrace, these have represented what we've learned about scoliosis and bracing effectiveness over the years. And these modern corrective braces address many of the shortcomings associated with traditional bracing. The ScoliBrace or corrective bracing offers a potential to try to reduce the scoliosis more significantly than just trying to slow it down. And this is by improving the spine and the scoliosis and the effects associated with scoliosis, such like bad posture. Scoliosis introduces a lot of uneven forces to the spine and body and surrounding tissues, and this causes the entire body to adapt to the scoliosis over time. These uneven forces disrupt the body's overall symmetry, which can lead to postural changes. Now, postural changes I want to talk about because there's a really big difference between bad posture and scoliosis bad posture. Bad posture normally occurs to patients that just don't stand normally, meaning they may stand with their head forward, or they may stand kind of slouched. And if you tell them to kind of correct it, they can stand straight and everything disappears. However, what's the difference with scoliosis is scoliosis causes structural changes. So maybe you tell the patient with scoliosis to stand straighter, and they may stand a little bit more up, but they still have what we see as the postural asymmetry associated with scoliosis. So it's truly a structural postural change. And unfortunately, since scoliosis is a progressive condition, its very nature to worsen over time, meaning that this structural postural deformity or postural changes become more severe as the scoliosis becomes more severe and becomes more and more noticeable. So when these postural changes start to occur in very early signs of scoliosis, you may just see simply uneven shoulders or uneven hips or an asymmetrical waist or abnormal spacing between the arms. But however, as the curve changes and as this curve becomes more significant, these postural changes now lead to structural changes and developments occurring within the rib cage and arches themselves, within the shape of the ribs and bones. It can start making the arms hang at more significant differences. It can start causing the posture or the body to shift significantly over one side of the body versus the other. It's very prominent lean. And as this curve progresses, these things will continue to worsen and worsen because the changes become more bony in nature and more structural. Now, postural changes is definitely the most common thing that we use to diagnose scoliosis, and this is true in children and adults. This is what brings on the diagnosis. In children, we typically don't experience any type of symptoms or pain, so postural changes is the number one sign. There is never a normal reason for patients to have asymmetrical posture, meaning one side to look different than the other side. This could be a sign of an early onset of scoliosis. Now, adult patients, not only do we see these postural changes, however, what normally brings on treatment for an adult patient is pain. Because scoliosis after skeletal maturity becomes compressive as a result of gravity over time, it can start leading to pain and discomfort. So therefore, most adult patients seek treatment because of this. Scoliosis can include many different types of pain, but it can affect the muscles. It can cause back pain that's radiating into the extremities. It can cause localized pain. Typically, it starts off dull, achy at the site of curve, and as the curve gets bigger and as the patient gets older, this achy pain leads to more fatigue and more tiredness, and then lastly, it turns into radiating nerve-related pain. There can also be changes to movement as a result of this, because as the body changes and the posture changes, it can start affecting balance, coordination, and gait. Now, when we look at back bracing and how this affects scoliosis, well, initially, bracing is just trying to stop the curve from worsening. And this is traditional bracing, meaning like Boston braces or Providence braces. They're not really trying to reduce the curvature or not trying to make it smaller. They're just trying to slow it down. So most of the time, these braces are limited in use to adolescent cases that are rapidly growing. So they're trying to slow the progression during this stage. However, corrective back braces can be used in any age because they're designed to put a corrective force into the body. So therefore, a corrective brace that's trying to improve the shape of the spine and body and try to realign what we found as a result of this structural postural changes that have occurred can be used in any age group as a conservative treatment approach. Now, typically, these conservative treatments not only rely on bracing, but they also rely on other types of treatment as well. But they can have a significant effect on the shape of the body. While back brace alone can't correct the underlying cause of scoliosis, because in most cases we don't know what's causing it, it can affect what we see outwardly, meaning the shape of the body, especially when a brace is combined with other facets of treatment that can really improve the spine and reverse potentially some of the misalignments that have occurred as a result of scoliosis, including these postural changes. These other things can include like chiropractic care that really works on addressing structural spinal issues. It can be like physical therapy, scoliosis-specific exercises that focus on the core's muscles, the strength and the balance of the tissues, and also improve a postural carriage of them. It can be postural remodeling. It can be neuromuscular education to help treat the way the body is interpreting the nerve system and how it reacts reflectively to the body. And all of these approaches are combined with bracing to provide the most effective treatment. So therefore, the best way to minimize how scoliosis affects the shape of the torso and posture is to be proactive with treatment, meaning the smaller the curve, typically the smaller the postural problem, typically the easier it is to improve. So proactive conservative treatment works at preventing progression and really trying to improve the effects when they're smaller. However, unfortunately, most curves that we see in the clinic have progressed to significant size, and we're seeing significant posture differences in the body. However, these patients can be improved as well, but we're looking at just reducing the significance of the size. We're not looking at total resolution, but we can make significant changes when we combine corrective bracing, chiropractic care, therapy, exercise, rehab, and many other therapies to improve the symmetry of the body. Thanks for watching. I hope you found this information helpful. If you have any questions about this topic or other scoliosis questions, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish new videos just like this.